All right, what is going on, everybody? Hope you all are doing well. So today we're going to be talking about headaches, specifically in the therapeutic world. Cognitive behavioral therapy for headaches is an evidence-based tool to help patients that are going through experiencing headaches. It's really good to be able to work with a primary care physician, perhaps a nutritionist, maybe a psychiatrist as well. You're going to want a multidisciplinary approach to headaches. In general, if we're talking about a sinus headache, think of it as a dull ache or pain around the forehead, eyes, the nose, and the cheeks. This is a type of headache that can result from a sinus infection, but could also be confused with other types of headaches or migraines. Believe it or not, there are different types of headaches, but typically the underlying cause of a sinus headache is a pain or pressure in the sinuses. Risk factors for sinus headaches could include any type of personal or family history of headaches, frequent infections. Now we're going to go into tension headaches. These are some of the most common types of headaches. It's kind of like a band-like pressure or like a tightness, and it affects the forehead, the temples, the back of the head. These are typically periodic or episodic, and so they can sometimes persist constantly for a period of weeks or months. If it's getting into the months, then it's chronic, but typically, they're happening periodically. The underlying cause of this is not exactly fully understood. They can be triggered by a ton of stuff. Typically, I've seen clients where it usually gets triggered by stress, and there can be an increased sensitivity to pain. When you think about tension headaches, think about it as, again, a tightness or pressure. This could also result as a dull pain or a tenderness of the head, the neck, and the shoulders, and it's going to typically affect both sides of the head. That's really important. Some of the same types of treatment for tension headaches, migraine headaches are not going to differ as much. But in terms of, for example, cognitive behavioral therapy for headache treatment, being able to parse out what type of headache it is actually a part of the therapeutic treatment and the psychoeducation. So I think that is always helpful for patients to be able to pinpoint exactly what exactly is going on and why exactly am I feeling this way. So the next type of headache is going to be a cluster headache. These are rare, and these are worse than the sinus headaches. These are very, very painful. They can occur multiple times a day for a period of weeks, sometimes a month. The underlying cause, again, is not necessarily completely understood. Men are more likely than women to have this type of a headache, as are individuals with a family history of the condition. Anytime you have a patient who is drinking alcohol or using tobacco, that could trigger or worsen a cluster headache. So you got to be aware of that. And these, again, are intense, severe pains, typically happening around, above, or behind the eye, and really it's causing some intense swelling of the eye, sometimes a runny nose, or even facial sweating or redness that can happen as well. And then last but not least, we come to what is commonly known as the migraine headaches. Usually on one side of the head, they may be preceded by a period of symptoms, maybe a sensitivity to light, to sound, and is feelings of fatigue, weakness, numbness of the limbs. Different environmental factors can contribute to it: difficulty sleeping, medication, exercise habits, hormone levels. These are all prime symptoms or sort of triggers of the headache. Now, as I mentioned, the throbbing, the pulsing can also sometimes lead to nausea, vomiting. The pain is typically moderate to severe, and it's usually on one side of the head, but sometimes it can affect both sides of the head. So that's where it gets a little bit confusing with the tension headache. These are more intense than the tension headaches. And so based on the severity of the pain, you can pretty much parse out what exactly is going on. But as a migraine attack progresses, the pain usually does become more diffuse, and it does kind of spread to other areas of the brain or the face before dissipating or before actually kind of relieving itself. And so there are a number of different treatment plans for headaches, sometimes medications. I already mentioned cognitive behavioral therapy treatment. Getting a massage can also be helpful as well. Changing diet being able to figure out if there's an allergic reaction that's contributing to the migraine, getting lots of exercise, drinking water, sleeping, really reducing stress levels. So these are all different ways to kind of figure out and alleviate some of the pressure that happens from migraines. I've also seen a lot of patients who will get different types of treatment for like Botox. What's really happened with migraines is that there's a nerve impulse that's happening. And so Botox typically does help with that to some extent. So again, a combination of treatment is probably what's going to be the best for migraines, tension headaches, sinus headaches, as well as cluster headaches.